Right, okay guys, we are at 81 people, fantastic, let's start. So welcome to the July TMF reference model meeting from a very sunny, very warm UK, which we're delighted about because I have to say it's been like winter. And so I know across in the States you've had a lot of heat waves, but we haven't. So we're very delighted for it to be slightly warmer today. So glad to be here. Got quite a packed agenda today, and so I am going to move straight on and cover off what we're talking about. So a little bit about the membership, and then we're going to talk about the zone teams. Very important, we need your help, and we are reinvigorating the zone teams, and we're going to have JP and Kelly telling us all about that. A very quick slide on ICHE 6, and then Jill Gittins is going to talk about the draft EMA guidelines. We're going to have Eldon talking about e-signatures, and then we're going to finish off with the 1572s, which will either be a very short conversation if we've run out of time, or a very long conversation depending on how much time we have left. So without further ado, let's go and talk about the membership. So as everybody knows, just as a reminder, for those of you who are new here today, we have a number of different places we communicate. We have the groups.io, which is for the project team, and actually Kelly and JP will talk quite a lot about this, so I don't need to go into too much detail, but that's the people who are actively involved in the TMF. We then have 1,500 subscribers on tmfreferencemodel.com, and you should all have received an email from me finally about an hour ago. Unfortunately, the website seemed to have some issues, so that's why it's taken so long to get the message to you. If you didn't get a message, either you haven't subscribed or it's being blocked by your spam. So make sure you go and have a look for that. And then, of course, our LinkedIn group's got 3,600 people, which is quite amazing. So lots of people, great community. TMF is always a great place to be. So just as a reminder, we have a wonderful group of people here. So what I'm going to do now is I'm going to actually hand straight over to Kelly and JP. Kelly is one of the co-leads of the Change Control Board, and I'm going to not introduce JP, but I'm going to let JP tell you who he is and what they're doing. So Kelly and JP, over to you. I will move the slides forward and take myself off video. So over to you.
Great. Thanks, Karen. I'm just going to do a brief introduction. I'm going to let JP take it away. In the last general meeting, I briefly presented about re-energizing the zone teams. They're such an important part of, you know, the TMF reference model and reviewing and getting changes done. And it's a great way to get involved with the TMF reference model on a project team. And so we kind of talked about some challenges and really wanted to re-energize that. And we had talked about a zone team liaison. And I'm really, really pleased to announce that JP Maselli is going to be the zone team liaison for the TMF reference model change control board. He's got a wealth of experience, tons of experience on the zone teams and the CCB and within TMF. And so I'm going to let him introduce himself, and he's going to take it away with what our future plans are. Thanks.
Thank you, Kelly, and thank you, Karen, as well. Can you guys hear me okay?
Absolutely, loud and clear.
Thanks, Karen. So hi, everyone. Good morning, good afternoon. As Kelly mentioned, this is an exciting new opportunity. You know, excited to talk to everyone about this today. So if Karen, you could go to the next slide, I'll just give a quick intro for those of you who may not know me. I've been in the pharma and biotech space about 20 years now, with most of that time dedicated to working with the TMF. Wasn't until early 2010 where I really started to love the TMF, thanks to people like you, Karen, as well as Lisa Mulcahy and Fran Ross, just to name a few. And from there, it just kind of grew and hasn't stopped since. Became a member of the Change Control Board in 2018. Currently a member of the Zone 1 group, as well as the lead for Zone 7. Of course, I will be vacating that spot in order to take on this new role as the zone team liaison. Next slide. So in this new role, it will continue within the change control board, which is great, which, as I mentioned, I've been a part of for a little over 3 years now. But this new role will really be focusing on getting the zone teams coordinated through periodic meetings and updating them on all of the activities that we talk about on a regular basis in our change control board meetings. I'll also be the main point of contact for any zone changes, such as a change in an individual zone lead, as well as following up with each of the zone teams to ensure that any requests are reviewed in a timely manner. And then again, through normal interaction with the CCB, I'll reporting on any updates or concerns from the zone teams and any of the relevant activity going on. Next slide, Karen. So for those of you who may not be familiar with the zone teams, these have been around for a few years now at least. And the people who are involved in these contribute to the reference model in several ways. The first thing is they review change requests that are submitted and provide feedback to, discuss and review those changes to individual artifacts within the zone, suggesting updates on any new regulatory guidances that may impact the artifacts within each zone. And that includes just, consistency within the reference model, the potential for maybe new artifacts or sub-artifacts, as well as a lot of the other information related to them, such as milestones and references to ICH as well, and definitions. So this is a really important need, as mentioned by both Karen and Kelly. So the goal here really is to get the zone teams re-energized, as mentioned before, to start contributing to these efforts to review on a regular basis each zone within the reference model. So if you are interested in becoming a zone team member, there are certain responsibilities and qualifications that we typically like to see. First and most important as well is just the willingness to commit to reviewing these change requests and artifacts and doing this on a regular basis and again within a timely manner. It's not a high time commitment. It is fairly minimal. So it's not a huge expectation, but the expectation is that when there is activity going on, that people are available to review any pending requests. And if everyone else could please put their phone on mute, that would be great. Some of the other kind of basic responsibilities.
Welcome to Zoom. Enter your meeting ID.
Should be fine now.
So I had a problem there. I clicked on, I muted JP by mistake. JP, you need to unmute yourself. I'm very sorry. Hold on.
That's okay. Can you hear me now?
I did, but I was trying to mute whoever was talking and the people's names moved around and I muted you by mistake. So sorry about that. I'll pay more attention next time.
That's okay. You can hear me now though.
I can hear you perfectly. Absolutely.
Okay, great. So of course, we're also looking for anyone who is interested in contributing to the TMF reference model. And if you have prior experience within a specific zone area, that is definitely preferred as well. Next slide, Karen. So as far as the zone team leads go, there are also some responsibilities listed here for that expectation. Again, the commitment to review the change requests and artifacts within the zone, to be that point of contact between myself, the CCB, and each of the respective zones on all the activity going on within those zone teams. A zone team lead also cannot be a current member of the steering committee, and then wherever possible, also not a current member of the change control board. Also, just like with the zone team member, experience with the specific zone area is preferred, and of course, experience with the TMF reference model as well. And then all zone team leads do have to be approved by the CCB. Next slide, Karen. So if anyone out there is interested in being a zone team lead, please feel free to email me. My name and email address is shown there. As you can see, there are several zones for which we currently do need a team lead, almost all of them. And in addition to the individual zone team leads, we are also looking for a person who can provide feedback and contribute across all zones when it relates to device process and any changes that may impact based off of that. So if you are interested or if you know anyone that is interested, please feel free to email me. For anyone who is currently a zone team lead or zone team member, you may have noticed or should hopefully have noticed an email go out just within the past day or so to confirm your participation. So for anyone on the meeting who did receive that, please do respond back within the next week or so if possible, as we look to lock down exactly who we have on each of the zone teams for both members and leads, and then try to identify new people who would like to join. So please reach out to me with any questions. And then the last few slides, Karen, really just, if you go to the next one.
I'm just going to,
sure.
I was just going to put your email address in the chat.
Okay.
Because I think if anybody wants to, if anyone's thinking about it right now, it's probably best that they email you right this very second.
Yes, definitely.
At advancedclinical.com. There you are. Sorry, I just wanted to, because obviously otherwise the slides take, you know, a day or two to come out and that. So if anybody wants to get involved, they should be emailing you right now. Is that right?
Yes.
Excellent.
Correct.
So all in the chat, guys. James Ellie at advancedclinical.com. Thanks, JP. Sorry, next slide. I will let you have the next slide now.
Thanks, Karen. The last few slides are really just a quick overview on how to join a zone team if you're not familiar with how to do this. From the main TMF reference model page, there is a link under About the Model where you can click on Join a Team. And the next two slides really just take you through the rest of that process, so I won't read through them in their entirety. But if you go to the next one, Karen, the zone teams use what's called the groups.io portal page. And this is where Karen showed on the membership slide a little while ago. There's a little over 300 members. So we will be going through that and cleaning it up, but it's through this page where you can click on an apply for membership link, which will need to get validated through your email that you subscribe under. And then if you go to the last and final slide, Karen, whoops. This here again just describes what happens when you will sign up for membership through this link. And if anyone has any issues or questions about this process as well, I know it's a little hard to kind of take this in going through it pretty quickly, but I can certainly help out via email if anyone has any problems or questions about signing up through the portal page. And that was it. Thank you, Karen.
Thank you very much, JP. I have to say that the zone teams, I know we've talked about zone teams a bit, they are the most important thing in terms of review of the TMF. A lot of people have a lot of comments and we really need people to give time and energy. I think it's not just time, it's energy. The reference model's been going for 11 years now, and we need to get some more energy and new people into the teams as well. So guys, if you've benefited from this over the last 10 or 11 years, now's the time to give back and help JP, help Kelly, help the Change Control Board, and actually step up and be part of the team. So please do. JP, I'm hoping that your email is going to, your inbox is just going to be flooded now with people. That's my fingers crossed. So, Kelly, anything?
Karen, yeah, sure. I just wanted to add to emailing JP if you want to be a zone team lead. But if you want to just join a zone team, just follow those 3 slides at the end and subscribe to the zones that you want. You don't need approval to join a team as a member.
Very good point. Very good point, Kelly. So yeah, absolutely. So these slides will be available. And in fact, I'm going to ask somebody can somebody go and copy the link of the groups.io portal page that's on this slide and stick it in the chat, please? Now, I'm either going to get 30 people doing it, or I'm not going to have anyone do it. So whoever gets there first, the others don't need to. But if we can put the link in the chat, that means that people, while we're on the call, can go and click on and say, yeah, they want to be a member of a zone team. So I'll just hang fire and hopefully somebody will put it in. So fantastic. Thank you very much. Kelly, anything else to add? Anyone else got any comments or questions?
Nope. Looking forward to working with some new people. It's fantastic.
And I'd like to personally say, JP, thank you so much, because I think this has been desperately lacking as someone to do the coordination between the teams. So it's going to be a lot of work. And so we appreciate it before you've even started, shall we say.
Thank you, Karen. Looking forward to it.
I know, absolutely. Oh, thank you, Laurie. You're a darling. Right, nobody else needs to post it. So the link's there for the Groups.io group, and you can join. And if you are a member, go and become part of a zone team. We need teams everywhere. So, okay. So the next thing that we're going to just talk about, we're actually not really going to talk about it because it was an update on ICHE 6R3. There isn't really an update that I know of. So if anybody has anything further that they know of, because don't forget, we're not directly in the loop being conversed with all the time. But I just wanted to, in the slides, put in the links again so that people can go and see, oh, hours and hours and hours of endless fun at the CTTI, the recordings of the webinars. As I said, I don't know anything more about any updates. If anybody has any updates, put them in the chat. Come on and chat. But I don't know anything further. But we did promise that we would give you an update every time. So there's a good chance we're just going to have this slide in every deck for the next few months. But hopefully there'll be something by towards the end of the year. Okay, so now what I'd like to do, Jill, if you wouldn't mind, if I can hand over to you, to talk about the new draft guideline on computerized systems. And I have to say that I actually took a little bit of time to look at it as well. And it's quite intense from what I can see.
It is, yeah. Thanks, Karen. Are you okay to advance the slides if I just talk through them quickly?
Yeah, you don't have to go quickly. Absolutely no worries at all. We're good for time, so you don't need to race.
Okay, all right.
Let me just take myself off video. Right, okay, so, oh, do you want to do an introduction and then we'll take it from there?
Okay. So for those who don't know me, my name is Jill Gittins. Please don't call me Gillian, only my mother does that. I just wanted to come along today and just give you an update on this draft guideline. When I first raised it, I think at the steering committee, it hadn't long been published and not many people were aware of it. And so it may just be some, you know, because I work in Europe, but I do think it's important to be aware of it. It is draft guidance. It was published on June the 10th this year. So it's in that kind of public consultation period that these guidelines, these draft guidelines always have. So it's a 6-month consultation period that is due to end, I think around just before Christmas, so December. Obviously what happens after then is that all of that submission, the feedback needs to be collected, and then they'll obviously confirm an effective date, but there isn't one at the moment. Next slide, please. So I guess the purpose of the guidance, and this has come from the guidance, it's recognizing that there have been changes in clinical trials. It's recognizing that there's been an increased use of systems. And obviously guidance needs to be reflective of that, changes in trial types, changes in data, the way that we use systems, the way that we collect the data. There was a previous paper, so there was a reflection paper on expectations for source data and data transcribed to electronic data collection tools. And this, I guess, started to address the challenges when it was first published back in 2010. However, obviously since then, you know, we've literally completely changed the way that we use systems, the amount of systems that we use in clinical trials. And so it was pretty obvious that we needed more up-to-date guidelines just to really deal with that, the increased use of systems, including eTMF systems, has really presented, I guess, all of us with a world of new challenges that we need to embrace. So next slide, Karen. So the actual scope of the guidance I've just tried to kind of summarize here. I think the previous reflection paper scope really only included 5 system or instrument types. So it's quite specific in talking about ECRFs, EDC, IVRS response systems, the instruments that the investigators use at site, and then some of those systems that support analysis of patient data and scans and imaging and all of that. Whereas the scope in this particular guidance has been expanded to include, obviously now where a lot of sites are using electronic health records, use of CTMS. I think every second sponsor and CRO uses a CTMS system. We've got document management systems, we've got SUSAR database systems, site portals, you name it, we've got it. And obviously we've got eTMF. So it's a much longer list of systems that are in scope. Specifically with regards to eTMF, it mentions it, but it's not gone into great detail about eTMF systems, obviously because EMA has already published very specific guidelines about the trial master file. But I do think it is an interesting read. Whether you want to read it over your Cheerios, I don't know. It is intense, but for all of us that are working in clinical trial technology, I do think it's worth reading and being aware of some of this guidance that's going to come into effect in the next 2 to 3 years. It does advise, as most guidance does with EMA, about having a risk-based approach to things, but it very much advises of a risk-based approach to computer systems validation, and that risk-based approach should consider things like the relevance of the system, what it's used for, is it used directly with the subjects, is it to do with safety and the importance and the integrity of the data. All of those sorts of things need to be included when you're looking at the risk-based approach. Next slide. So when I was looking through it, it was just very interesting for me to see some of these new definitions that had been put into the guidance. And I looked at it in relation to the 2010 reflection paper. And so obviously with changes in trials and use of systems, we know these definitions. So it's interesting to see them actually in the EMA guidance. Those of us who work in technology know obviously what artificial intelligence is, but the guidance gives us that definition. So it's covering a very broad set of algorithms which enable computers to effectively mimic human intelligence. Machine learning is a subset of that artificial intelligence and includes the computer algorithms which are trained to sort of classify or even predict, if you're that good, the actual metadata, and that goes with eTMF systems as well. And then you've got deep learning, which is a subset of machine learning and contains algorithms which allow really for software to train itself. And technical terms, it exposes it to all these different neural networks and things, and then that works the data. So the guidance has very much embraced these new technologies, these new ways of working, and therefore has put definitions in for all of those things. It also talks about dynamic files, so your spreadsheets with all your automatic calculations, and we've been talking about inclusion of dynamic files in eTMFs for a while. So it talks about that, it gives definitions, it talks about certified copies and static files such as your PDF scans providing information on data that's fixed within that file. And it also talks about paper documents being digitized as PDF. So again, very much to do with the TMF processes that we're all used to at the moment. It also talks about good document practice. And I don't know about you, but I always used to think about that very much being involved with GMP. But it does give a definition of this. It's the practice to describe a standard for creation and maintenance of documentation in order to ensure integrity. Also, the other thing I wanted to talk about is ALCOA principles, because I know that the reflection paper from 2010 talked about ALCOA, but it didn't ever really use the acronym, so it never actually went into the detail of what ALCOA stands for. So it's included that within the definitions as well. Next slide, Karen, please. So what are the principles of the guidance? So there are a lot of principles, again, much more than was included in the 2010 paper. It covers data integrity. So when data is collected and maintained in a secure manner, It covers roles and responsibilities. So for systems, we're talking about things like the vendors who provide those systems, the people that use those systems. All of that information has to be clear. It also talks about electronic data and metadata. So the context of metadata being by itself has no meaning. So when it's attributed to another piece of data, it covers things like source data and data flows. Again, talks about ALCOA, but it talks about the importance of ALCOA. So it really does say that it's important that we follow those principles: attributable, legible, blah, blah, blah. I'm sure we all know those. The plus as well. So you've got your extra data being consistent, enduring, available, and traceable. So it's good to see that it's not only talking about ALCOA, but it's talking about ALCOA plus. As you would expect, it talks about risks, as we've mentioned, but the criticality of those risks, especially when we're talking about data integrity and then going through your system life cycles, that sort of information. Data capture, I think, is important. It's the importance of the protocol and other trial documents to specify in which way data is going to be generated and captured, and the tools and the procedures that are going to be used. So the guidance is telling us to make sure that we have all of that information in our protocols. It does also provide a bit of guidance on e-signatures. I know I always look to 21 CFR Part 11 when I want to look at guidance on e-signatures, but in this document there is some guidance. It is very similar to what the FDA say in that it talks about, you know, open and closed systems. You know, so the eTMF system is considered a closed system because all the users and those that sign within an eTMF have been identified in advance. So there's more control, whereas obviously with the open systems, there isn't. It states when an electronic signature can be used to replace a wet ink signature, and now says that obviously that e-signature functionality should meet EMA expectations around things like, you know, making sure that the signatory can't deny that they've signed that, making sure you've got your time stamps, the date, time zone, all of that when the signature was applied. So it's got some great guidance around that. In terms of data protection, as you would expect, being EMA guidance, it relates to GDPR. So in accordance with legislation, I think the location of personal data must be processed within the EU. It does stipulate that, and it talks about guidance if that personal data is going to be transferred to another country or another organization. It does say that that data transfer must comply with GDPR. So it is interesting that it's included information about that. It talks generally about all computer systems being used within a trial that should be subject to processes that confirm, you know, that the requirements of the system are consistently fulfilled, that the system is fit for purpose, I think generally is the statement that it makes, and that all systems should be readily available and directly accessible by the regulatory authorities. I think that's a big one. It came up in the MHRA GCP inspectors report where they spoke about that, it being a finding where sponsor companies hadn't given direct access to other systems. They may have done it with the eTMF, but they didn't think about other systems as well. So there's much more detail in this guidance than there was in the reflection paper, which really only sort of talked very quickly about ALCOA principles and creation of systems. There's much more in this guidance around the principles of that. So there's a lot of information, and as Karen said, it is very intense, but I do think it's worth reading. Next slide. Some other things that I hadn't seen being covered anywhere, and working very closely with eTMFs, we do come up against this, is decommissioning of systems and archiving of systems. So there is guidance around the decommissioning of really it talks about databases. So it's going to be really specifically around EDC, but it is worth taking this guidance into consideration. So making sure that you have clear instruction on how you're going to decommission a database, also covering things like the possibility of restoring the database to full functionality if it's ever required for inspection, and that would include things like dynamic features as well. So you need to be aware of what the recommendations are there. Contracts with vendors, also important. me being a vendor, but they've spoken about the fact that the delegation of tasks and responsibilities must be very clearly indicated when you use a vendor for electronic systems. So you've got to think about things like service level agreements, make sure that they cover things like system downtime and where the data is being hosted, that type of stuff. As you would expect, it also covers user access, and user security. One thing I didn't put on here, Karen, that I also did read when I was looking at again this morning over my Cheerios, was that it mentions risk-based audit trail reviews. And I've been talking a lot about audit trail reviews to a lot of our clients, because we talk about quality review of the eTMF, but sometimes we forget that that should include an audit trail review, and that should be in place and should be documented. The guidance also states that it should focus really on that critical data. So I would advise people to be aware that they need to be doing audit trail reviews to cover things like missing data, to check that data's not been manipulated and that, you know, any abnormal data or outliers has been identified. And also maybe metadata review within your eTMF systems, but also review of your access logs and your event logs and your queries and all of that. Everything that's behind your eTMF system should be part of that audit trail review, but take a risk-based approach as to how you do that. And then last slide, Karen, if you move on, is a link to actually download the guidance. As I said, it was released last month, so it's been out for maybe 4 or 5 weeks. As I said, that it is in public consultation period, so you can go and download it, have a read, and obviously all of us in the industry can submit feedback. I think there is an AMA submission form that you can get from the website as to anything that you want included in the actual final guidance or any feedback that we have on the draft as it is at the moment. So I just wanted everybody, as I said, to be aware of it, to go and download it, make sure that your QA department has it and has read it as well, and really just to give us a heads up as to what we think will come within the final guidance when it's probably published in maybe a year or 2 years' time.
And Jill, this is Marion from Flex.
Hello.
Hi, how are you doing?
I'm good, thank you.
I have put in the chat the link to the official, form to use for feedback.
Oh, thank you. Thanks. Thank you very much, Marion.
And I really think, I've spent some time on this, and it does have a lot of information, but I also think that it's not clear about some things. I found it interesting that, they talked a lot about systems, but then didn't necessarily get down to some of the systems that, I think maybe should be out of scope of this, like your SharePoint, yet we all use them. Should your LMS be part of this, your QMS, there's a lot of things that it kind of is a real gray area. Also, when they talk about all the electronic systems that we use, sometimes we also forget about the fact that we use our phone a lot, and the apps on there as well. So
absolutely. The apps thing is a great one. Yep, definitely agree. I think there may be some. I think when they get the feedback in, they may find that they include other systems, or if they want to talk specifically about another system, they may find that they're going to introduce a guideline specifically on the use of a particular system. I don't know, but that it may be that's what they do. But I think you're right. There are grey areas because there are so many different systems now and different ways of accessing data that they were never going to be able to cover everything. But I think what we need to do as the public and the audience is try and make them aware that they need to be much more descriptive and less ambiguous than some of this guidance is. I agree.
Yeah, and also some of those definitions that are on there, I think need some tweaking. Is they're a little archaic, and especially the one about documentation, what that is, and they really don't get into the raw data, which I think is a critical piece as well. So,
yep, absolutely.
Just from my review.
Hi.
Thank you for reviewing it.
This is Jessica Knowlton. I'm a new member, and this is my first meeting here, and this is a really important guidance. I was wondering, does the TMF organization ever provide like official feedback on these types of guidances where, you know, we come together, solicit feedback from our organization and then provide that feedback. I was looking through some of the membership teams and like who's a member, and there are actually some members that work for trial master file organizations like Viva. So I just was wondering if that's any sort of activity that we could engage in.
Karen, I'll let you answer that. I don't know of us doing it collectively. I do know because the ALCOA are doing collective feedback as an organisation, but they're doing it very much as part of their own quality feedback, which you would expect. But Karen, we're not doing anything as a collective effort, are we?
No, I have to say that I'm just thinking back, and somebody helped me out here over the last 11 years. There was something.
Yeah, there's the same EMA draft guidance on electronic trial master files.
Was that the one that we gave formal feedback on, Todd?
Yeah. And maybe this one should be, you know, based on what I heard today, right? I think we need to look at this closely and see if it's worth doing the same.
Yeah, and if you remember correctly, the last one, what I was going to say was how important it is to comment, because the last one that came out had some very strange things in, and everybody commented, and a lot of the strange things were removed. I know Eldon's done a review.
It was like retention. There was something about retention or something in that original draft guidance for TMF that everybody was quite surprised at.
Well, there was one that Eldon, I'm stealing your review piece, but I thought it was they were talking about having some unbreakable link between a paper signature and an electronic document. So if you have a document that you then print out and sign the signature page, you need to have like a checksum on the signature page to show there's an unbreakable link to the electronic document, which just is A, not practical, B, not going to happen, and C, not what the inspectors have asked us to do. They've just said make sure that you can tell what the document is. So, but
I'm pretty sure, just to kind of answer the original question, when we did provide feedback as the TMF reference model, we also encouraged everybody individually in your own company's context.
Absolutely, we did that.
Feedback.
Yep.
Yeah, I wonder. Maybe we should take that back as a steering committee and just talk about it.
Agreed.
Because you know, Jessica, it's a very good point. As I said, we've looked at it. I know, like at Flex, we looked at it, and so at TI, you're going to look at Aviva, all the Pfizer's, and everybody else is going to look at it. And I know that it's people who have clients who are then asking people to comment. But maybe we should try and have a consolidated effort. Jill, there was a question from Russell about, is there anything on the guide regarding computer software assurance, CSA, trending as the new CSV? Did you see anything on that?
I didn't see anything with that terminology. That's interesting. I mean, I can do a quick find on it, but I don't think I saw anything with that terminology. Is that the new terminology for CSV?
It seems to be an emerging. I can't remember if it's with the ICHG3 Rev or something else, and maybe Russell can fill us in. But I know I've started to hear that concept and term, which isn't altogether that different, but it is a new term.
Yeah, no, I mean, I've just done a word search on the document, a PDF search, and the word assurance only comes up once. So just from that alone, I'd say no. But it'd be interesting to know if that is maybe a term that they're going to use moving forward when they finalise it. But not for the moment, Russell, no.
Alison, as you're on, can you stick it on the next steering committee agenda so we'll have a chat about what we do? Thank you very much.
Yep, I'll do that.
You're a darling, thank you. Okay, in the interest of moving on, Gillian, that was brilliant. Gillian, why did I call you Gillian? I'm sorry.
I don't know, Mum.
I don't know. I'm sorry. I don't know. I wrote Gillian on the thing. I'm so sorry.
That's fine.
Lisa's daughter's called Gillian. That's what it is. Sorry.
Let's blame it on Lisa.
Well, exactly.
Thank you very much.
I told Gillian that she's always going to be Gillian.
Yeah. So, Jill, thank you very much. That was brilliant. I think something very, very important that we talk about. So on an equally important note, maybe not equally, but close to equally important note, I'm going to ask Eldon to come and talk about the applicability of 21 CFR to third-party vendors, specifically around the sort of signature process. So Eldon, over to you, please.
Yeah, thank you. And sorry, I put builds in my slide, so just carry on clicking until each slide ends. So yeah, just to put this into context, I mean, we're all aware, I think, of the FDA requirements for electronic signatures. This is just a kind of brief potted history of it, but you'll see that we've had guidance from the FDA on electronic records and electronic signatures for over 25 years, actually. And kind of midway in that period in red in 2003, there was a bit of a rethink on the guidance as a result of industry feedback, actually. And I think that was quite an important moment that has probably been overlooked a little bit in terms of its importance. So there had been quite a bit of misunderstanding about the original guidance. And there was a perception that it was too burdensome, and people had really got the wrong idea around electronic records and electronic signatures. So the FDA withdrew a couple of documents, they revised their guidance, and then in 2007, they also produced their use of computerized systems in clinical investigations guidance. And a lot of those more recent documents are really focusing on having good practices in place for electronic records and electronic signatures for those systems that are used directly in clinical investigations. And kind of over the years, I've been kind of getting very familiar with 21 CFR 11, but I've had a kind of niggling concerns, I think, about how sometimes the regulations have been misinterpreted. Or in my perception, misinterpreted, and particularly in the last kind of couple of years since working for a TMF vendor, kind of concerned about how the regulations have been interpreted kind of along those lines too. So let's talk about what I'm actually talking about specifically. So next slide. So let's just take a standard kind of clinical trial, which is run by a clinical trial sponsor. But of course, clinical trials are never that simple. So you've got all kinds of other players involved. You've got, you might have a CRO. What does the CRO do? Well, they're conducting part of the study on behalf of the sponsor. There's some more builds on there, Karen, so you can carry on. But they may be storing their documents at an offsite archive. The offsite archive manages all the boxes using some flashy box management software. So they are using a vendor as well for their archive management software, and they've got IT people in their team, and they get trained on software engineering by another third party. So actually, when you look at this whole landscape of the clinical trials, it's not just the clinical trial sponsor, it's not just the clinical trial sponsor and the CRO. You've got all of these other players involved who, to a greater or lesser extent, have to be aware of GCP, have to be aware of all of the applicable regulations, and have to comply. And when we as a third-party vendor get audited by our clients, one of the first things they ask is, well, are you compliant with 21 CFR 11? And I'm thinking, well, okay, look at this picture on the screen. Who has to comply with 21 CFR 11? Clearly the sponsor does. The CRO doing data management does to a large extent. But how about the storage company? If we use Iron Mountain, does Iron Mountain have to comply with 21 CFR 11? And if you've got a company that's using, I don't know, O'Neill's software for document management, do they also have to comply with Part 11? And does the training company kind of, where does it end is kind of what I'm saying. So we go on to the next slide, Karen. Oh, okay, who needs to comply? So I thought, how do we answer this question? And we use an expression. So for those who aren't British, excuse me if you haven't heard of the expression, get the message straight from the horse's mouth, which is, let's ask the FDA. So that's what we decided to do, given the uncertainty in this area. We specifically asked the FDA. So this isn't for CROs and for sponsors, but in terms of subcontractors and other third parties, are they expected to comply with 21 CFR 11? Actually, even though their records are never submitted to the FDA, and are probably never likely to be reviewed by the FDA. And in putting that question to them, we wanted to be really explicit so that there was no misunderstanding. And we actually said, okay, as an example, without quoting our name, if you had a software developer selling an eTMF solution, Viva, TransPerfect, or whoever, the kind of records that they have in-house, like their validation records, training records, they might have SOPs that are electronically signed. Are those documents expected to comply with 21 CFR 11? Because when we get asked by our clients, they're all expecting all of those documents to be compliant with 21 CFR 11. So I'm hoping that you're now all sitting on the edge of your seat thinking, okay, what's the answer? What's the answer? Next slide, Karen. And so this is their response, and highlighting obviously is mine. So they've made it clear that this goes back to what I said in the introduction. The original kind of principle of 21 CFR 11 is really focused on people actually doing the clinical investigation. So the electronic systems that are used to produce required records, so that's their phrase, their term, in clinical investigations are required to comply with 21 Part 11. And the responsibility for compliance is the sponsors to ensure that the systems they use are reliable for regulatory purposes. So you've also got to meet other regulatory requirements like validation, etc. They've got to comply with GCP. But in terms of Part 11, the primary focus is on the systems that are being used to generate data and records on a clinical investigation. And then they said very specifically, this is cut and paste, with respect to subcontractors or third-party vendors, your SOPs, validation documentation, training records, and other documents that are part of your internal quality management systems that still need to comply with GCP, they are generally not regarded as required records of a clinical investigation, and they would not be subject to 21 CFR 11, including electronic signature requirements. So going to the last slide, Karen, which comes back to the graphic I showed earlier, and I've kind of put a line on that and said, okay, in terms of the sponsor and the CRO, I think it's clear that the vast majority of those systems are within scope if they are producing required records. But if we go below the line, then those, from this clarification from the FDA, is outside of the scope of 21 CFR 11. So those systems might still need to comply with GCP. They still need to be high quality electronic systems. They still need to be validated, etc. But they're not generating required records and would not be expected to comply with 21 CFR 11. So I just thought that was a useful clarification for either third parties on the line who have all of those IT systems, or if you're a sponsor and you're auditing and looking for third-party vendors, then set your expectations at the right level in terms of Part 11 requirements. They're subject to GCP requirements and validation, but from this new clarification from the FDA would not expect those records to be subject to Part 11.
Can I ask whether they quoted any sort of guidance documents as part of the response, or do you anticipate them producing any guidance documents as a result of this interaction?
I don't know. So at the moment, this is just a communication between the FDA and our company, but it's via the public interface to the FDA.
GCP inquiries, Elvin, is that what you used?
Yes. So in due course, this question and response will be anonymized and posted on the FDA website on the Q&A page.
At the link that I just added to the chat.
Yeah. Thanks, Todd.
Thank you.
And well, so it's up to industry then to,
They have said many times that Part 11 pertains to records that are required by a predicate rule. And that is really GCP, GLP, and GMP. And if records are not required by a predicate rule, then they're not subject to Part 11.
Yeah, so
that's
it seems
been in
as if
documents that they've produced in the past.
Yeah, so it seems as if this is actually saying, is providing additional clarification on that, because you're absolutely right. So, if you had, a vendor like, Viva, for example, then you would expect the predicate rule that applies there is records around validation, for example, records around maintaining written procedures, SOPs. But they've stated very clearly in their response that these documents would not be subject to 21 CFR 11, including electronic signature requirements. They've stated that very explicitly. So I think this is kind of just like a heads up, and I think this is probably a conversation that's going to continue. And yeah, I hope that they come up with some further guidance and clarification, because as the graphic shows, how far down the line do we go? The training company at the bottom, are we expecting all of their systems to be compliant with all of the different components of 21 CFR 11? I think that's just unrealistic.
Yeah, it's very common, as you know, Eldon, for people to sometimes assume that it is, right? And that's partly, why you had to ask the question, why we should make sure we ask these questions.
Yeah, and we get asked it all the time. You've got some aspect of your quality management system. Well, do you have double login each time you sign something? And we kind of say, well, why would you? Well, 21 CFR 11 requires it. Well, yeah, but for every computerized system, we don't have double logins for SharePoint.
We're all quiet when you talk about SharePoint, though.
Yeah, but it's the rules apply, predicate rules. If you're storing things in SharePoint, then in theory, if you apply this strictly, Part 11 should apply to SharePoint. So if we're saying, well, we'll bend the rules for SharePoint, is that okay?
Totally agree. I was just noting.
Yeah. So anyway, there's no kind of conclusion on this. It's just kind of a heads up that we've kind of probably opened up a can of worms, but I think it's a can of worms that has needed to be opened up for a few years. So kind of watch this space.
Brilliant. Thank you very much, Eldon. I think that things like this, the two things that we presented on today, so whether you're talking about signatures and compliance and whatever, or the guidance that's come out, I've got to be very careful, because I think sometimes we got ourselves into a pickle in terms of what we have to do. And I know, and I'm sure lots of people on this call have been asked about review of audit trails, and people have been told, oh, they need to go in and on a monthly basis or regular basis go in and actually review the audit trails themselves. And actually, when you start talking to the inspectors, they actually say, no, you need to be able to show your audit trails working. Well, we have validation that shows an audit trail's working. That's fine. And then we look at the output of the audit trail to maybe do reporting, etc. But I think sometimes there's a little too much of a tendency to just say, oh, we've been told to do that, so we're doing it, which is exactly what you're talking about here with the signatures. We've been told we have to sign everything, so we'll just sign everything with the 21 CFR Part 11 compliant signature. Oh, thanks, Deborah. Deborah has put about this computer software assurance and manufacturing quality system. The guidance intends to publish in fiscal year 2021. Thank you very much, Deborah. Right, so on the basis that we've got 3 minutes to go, we had one more topic, which I'm actually not going to talk about today. And the reason for that is because all too often we try and rush through things. So next, we're going to leave 1572s and signing of 1572s to the next session. And what we might do at the next session as well is also, depending on how things go, because the next session is September it's on the next slide, 13th, 10th, 15th, 17th, something like that. I'll get to it in a second. But the next session, I think would be good maybe if we've had a chance to dig into the guidance to maybe bring up the controversial areas, because I think it would be good for us to discuss about the things that have been put into guidances where we don't actually think they should be there. So To round out for today, thank you very much. So we had 96 people on the call, which was fantastic. So thank you very, very much, Eldon, for presenting, Jill for presenting, JP and Kelly for presenting. Thank you much for attending. To remind you that we have a couple of conferences coming up. We've got HSRAA, which I'm assuming is still going ahead, and I'm going to go to Russell just to make sure it's still going ahead virtually in September. And while he's coming off mute, I'll say that the next one we're going to be face-to-face is New Orleans. And we are planning not just on learning about TMFs, we are planning on having some fun as well. So if anyone can make it to New Orleans, please do. TMF is too much fun. And then Clinical Document World in New Jersey, obviously will be fun too. I think the whole appeal of New Orleans is great, having been there once before. So, and Jamie has confirmed that the HSRA conference is virtual, and it will be interactive webinars. So we will make sure you're kept up to date with that, no problem at all. And 13th, I knew it was a team, it had a 1 in front of it. So 13th of September. So it just remains me to say, everybody have a wonderful summer, because I think you're all in the Northern Hemisphere. If anyone's in the Southern Hemisphere, have a wonderful winter. Let's hope it stays warm. And please, please, please let everybody stay safe. And let's hope that by the next time we meet, the world is really heading back towards normality and we can all see each other again. So take care, everybody, and have fun. Bye.